Thank you, everybody, for joining us today. Quick little tips before we dive into our raffle items and our promotion codes. Just a quick little reminder, when you are ready to receive your certificate for today's program, you will receive 2 credits, one for Dr. Jan Bellows, one for Dr. Jeff Mayo. Please allow 5 to 7 business days for us to email you a certificate. It will be downloadable. You can save it. You can print it out. Just please allow 5 to 7 business days. It will be sent to the email address that is on file with your account or ones that you've logged in with today. If you have any questions, please feel free to go ahead and just send us an email at info@dvmcentral.com. And DVM Central is dedicated to you and your practice learning and growing. Dr. Jan Bellows received his undergraduate degree from University of Florida, his doctorate of veterinary medicine from Auburn. He practices companion animal medicine, surgery, and dentistry at All Pets Dental, and he's located in Weston, Florida. Dr. Bellows is board certified in dentistry with both veterinary practitioners and the American Veterinary Dental College. He was the president of the American Veterinary Dental College from 2012 to 2014, and he's also the current president of the Foundation of Veterinary Dentistry. Dr. Bellows, without further ado, the floor is yours.
Well, so what we're going to cover in the next 45 minutes or so are probably one of the most anxiety-ridden problems in veterinary dentistry is the tooth extraction complications. And face it, most of what we do in veterinary dentistry is extract teeth. And that is probably another lecture on why that is as compared to human dentistry, where most of what they do is prevention, prophylaxis, to try to prevent the situation when you have advanced periodontal disease. But with us right now, it's because pets don't brush their teeth, and clients, many of them don't pay enough attention to prevention care, then they create situations where you have advanced periodontal disease necessitating extractions. So we're going to talk about the extraction complications, then we're going to talk about how you treat them, and finally, how you prevent them. What are the complications that we worry about? Excessive bleeding, for sure. Root fragments that you left behind, trying to take out the teeth, they just snapped. How did that happen? We're going to get to it very soon, and we'll be able to share with you how to prevent that. Fractured roots itself. When you take out a tooth and it doesn't have a very, what they call a squishy bottom, very smooth, then it's something that you need to go out after and try to get that root tip. Jaw fractures. That's something that there are ways to prevent, there are ways to treat, but you certainly don't want to be in this situation. Oral nasal fistula. This occurs when you're taking out a canine tooth and you try to close the defect, but there's too much tension on it. So the animal opens up its mouth real wide, yawns, and a suture comes out, and then 2 sutures come out, and eventually you have a connection between the oral cavity and the nasal cavity. So food certainly goes down the throat, but it also goes into the nose, which isn't a place that it belongs. Another, anxiety-ridden problem and actually an extraction complication is just running out of time. You're trying really hard to figure out how much time you can devote to each patient. And we'll talk about that because, for folks that have one dental table and you have 3 or 4 dental procedures, how do you take out the teeth efficiently? How do you get your patient treated? And we'll cover that very shortly.
Dr. Jeff Mayo graduated from Oregon State University College of Veterinary Medicine in 1994 with honors. As well, he had a second doctorate in veterinary medicine from Washington State University. Prior to veterinary school, Dr. Mayo was a respiratory therapist at Duke University Medical Center, and he received his training in the field from Boise State University. Graduating with a degree in 1986. He practiced many different facets of respiratory therapy until 1990, at which he entered veterinary school full-time.
Sonoquence has evolved smooth wave technology to include bipolar turbo for the coagulation of larger bleeding vessels and bipolar dissection. Sonoquence's smooth wave tissue matching technology ensures a smooth and consistent cut through various tissue types by adapting their RF mode according to the tissue's water content. Unique bipolar turbo mode actually uses a lower power continuous wave to achieve an appropriate effect on hemostasis.
Is there a benefit for radiosurgery versus CO2 laser surgery?
I think that soft palate resection is successful with either of those. The laser turned out to be a fairly okay device for doing soft palate resection. My concern with the laser is the potential problems with, of course, a fire, setting the tube on fire, having oxygen back there, having scattered energy go around throughout the back of the pharynx area. You can end up causing some burns. Looking at the operational cost of the laser, you've got, if you're using a waveguide, that costs money, the tips cost money.
Quick little reminder, when you are ready to receive your certificate for today's program, you will receive 2 credits, one for Dr. Jan Bellows, one for Dr. Jeff Mayo. Please allow 5 to 7 business days for us to email you a certificate. It will be downloadable. You can save it. You can print it out. Just please allow 5 to 7 business days. It will be sent to the email address that is on file with your account or ones that you've logged in with today. If you have any questions, please feel free to go ahead and just send us an email at info@dvmcentral.com. Our marketplace is available to purchase your everyday items, both large and small. We have monthly deals, free samples, and great prices. We plan to be your reliable marketplace for your practice.